All right, good afternoon. This is our 5 o'clock update, what we do every single day on the coronavirus here in Kentucky. I'll start like I always start. We are going to get through this. Yes, times are going to get tougher before they get easier. Yes, we are going to be tested on our mental, our emotional, and our physical health. And yes, there will be some hard days on the road ahead, but we are going to get through this. We are strong, we are resilient, and we're going to do it together. We're going to do it by caring about each other. We're going to do it by following the behaviors and the modeling that make sure that we are protecting everybody else out there. So today, we're going to start and we're going to play a 5-minute video that's aimed for preschool children. And I will tell you, it is definitely aimed for preschool children. So this is something that get your kids if they're that age so that they can watch. I will tell you, if your kids are a little bit older, this is probably a little bit junior for them. But we are going to start this, and then after the 5-minute video, I'm going to go into some of the positive things that we see out there on social media to give you time to get your kids away from the TV, because after that, we're going to have to get serious about what the next couple weeks are going to look like. And then we'll move into what I think are some good news that we have seen today and we will see coming forward. So with that, we'll start the video, and I'll be back in about 5 minutes.
Hi friends, my name is Mrs. Miller. I'm looking around my school. Do you know why no one is at school? You're right. There is a germ going around that people are worried about. The germ is called the novel coronavirus, or COVID-19. It makes people sick. We have to stay home to keep everyone in Kentucky safe and healthy. I know all of your teachers and friends miss you. I miss all the children at my school. It makes me feel sad. Do you ever feel sad? It makes me angry. Do you feel angry? You may even feel like being alone or hiding, not talking to anyone. Having all of those feelings is okay. There are lots of scientists and doctors that are working hard to teach us about the coronavirus. What can you do to stay safe and healthy at home? You're right. You can eat healthy foods. Here are some healthy foods. Do you like carrots? Or green pepper? Oh, I really like strawberries and oranges. I know another way to stay healthy. You can wash your hands. Be sure you wash your hands a lot and wash them for a really long time. Can you think of a song while you're washing your hands? Is that song long enough? What else can you do while you're staying healthy at home? You're right. Exercise. Hey, do you know how to do a jumping jack? Here's what to do. Rocket ship, soldier. Rocket ship, soldier. Now, do some with me. The scientists tell us that you need to keep all of your toys clean. Soap and water help get rid of the coronavirus. Have you ever washed your toys? Gosh, that sounds like fun. I like bubbles. Lots and lots of bubbles. Ask a grown-up if you can wash your toys. I love to play. Playing is good for your brain. Look, I found a box. I love to play with boxes. You can color on a box. You can pretend with a box. You can even have soft toys or a special blanket while you're playing in a box. A box is a great place to be if you're feeling sad or just want to be alone. Playing inside is fun, but I really like to play outside. Hey, maybe you could ask a grown-up to take you outside. There are lots of things you can do outside, like a scavenger hunt. I found things walking around outside. I found a stick. This is a really cool rock. And even a pine cone. You can even play outside in the rain. Remember, we are staying at home to keep everyone, everywhere, safe from the coronavirus. You are brave. You can do hard things. I know you can. It is so great that we can all work together to take care of ourselves. We can do this because we are Team Kentucky. Bye, everyone.
I want to thank them for putting that together. You know, sometimes talking to our preschoolers at a time where they can feel our anxiety is hard. And I hope, especially for new parents, that it is a resource that helps moving forward. I'm now going to talk a little bit about some of the positive things we're seeing out there to give you time to get especially those young children away from the TV before we talk about some more serious issues. As we move through this in the coming weeks and the coming months, it is so important that we stay emotionally healthy, physically healthy, and mentally healthy. And because of that, we've asked each and every day for you to fill up social media, which so often can only exacerbate or increase our anxiety with the types of positive behaviors that we've wanted to see. And let me tell you, Kentucky, you are amazing. People out there who are filling their days doing such incredible things, amazing acts of generosity, just further solidify my faith that we can not only get through this, but we can do better than anybody else out there, which ought to be our goal. So here are a couple of examples. Look at this. This is ingenuity. This is SOAR talking about some of our community and technical colleges using 3D printing to help create some of the PPE, the personal protective equipment that we need out there. So Kentuckians, keep thinking. We have different manufacturers trying to retool and help. Now, this is our patriotic duty, and look at everybody stepping up and trying to find a way to do the things that protect our people. That's pretty special. Let's go to the next one. I love this. This is our Bowling Green city schools taking their unused supplies to their local health department and their community hospitals. And again, this is more of our communities coming together, hearing that call for all of the protective equipment that our frontline workers need and finding it and or making it. You know, that these are hard times, but in a way, they're special times because hard times can bring out the very best in us, and this is the very best in us. And then we see our teachers and our students finding new ways to interact, ways that we never thought we would be at and that we would be looking for, but that caring that goes on, knowing the loss that we have for not being in the classroom and finding every way we can to make up for it. And getting outdoors. Remember, we're going to talk in a little bit. Being healthy at home means you need to be at or around your home. It doesn't mean you can't get outside, and you should. You just have to keep that social distance. So, basketball courts can't be full of kids. They can't have teams playing right now. Playgrounds, you need to make sure that there are no crowds. That what we need to be doing is what this kiddo is modeling, is making sure you're playing, just with your family, but still getting outside is healthy for us. And again, every day we just see the outpouring of love and care from our kids. We see their resiliency. And as parents or as adults, we ought to be able to draw on their strength. At times of challenge, oftentimes we have been called to do very difficult things. Our challenge here is about staying home. It's about staying home more than we ever have. And while there are some challenges with that, folks, that's something we ought to be able to do. With the lives of so many in the balance, knowing what we're up against, we are simply asked to be diligent and to be resilient enough to do what it takes to get through this. Again, we need you to fill up social media with the positive. The positive is so critical for us as we are working to defeat this coronavirus. We want you each and every day to make sure that you're putting out those positive behaviors and the ones we want people to model using hashtags Team Kentucky, Together Kentucky, hashtag Patriot, because it is your patriotic duty to make sure you're limiting your contacts and engaging in social distancing and healthy at home. All right. So let's move into a little bit more serious. Folks, the next 2 to possibly 3 weeks is going to be absolutely critical in our battle against the coronavirus. What we are seeing is an escalation across the country. Kenneth, can you put up what we saw in some other states? We have Kenneth and Virginia helping today. Let's go to the next one, and then we'll come back to this one. We are seeing in many places a doubling of coronavirus cases every 2 days. These were the number of states that had more than 100 cases just reported out today. We are in that increase that we see on different graphs about pandemics. And the next 2 to 3 weeks are going to be absolutely critical. Kenneth, will you go to the last slide that we showed? And I want to tell you, what you're doing is working. Your sacrifice is helpful. This slide is a couple days old, but if you look at it, it's showing Kentucky versus other states as far as our numbers of positive tests. I have no doubt when we get more data, and this is limited data, that what we have done in the aggressive steps that we are taking is better protecting us than many around us. It's because so many of you have bought in, are doing the right things, are missing birthday parties of seniors or your kids aren't being able to see their friends. Those sacrifices will save lives, and I can tell you I'm proud of how we're doing. But in these next 2 weeks, we have to do even better. Kenneth, will you show the Seattle line graph? This is the Philadelphia St. Louis. If you'll pull up the other one. I know we haven't used the one I'm looking at in a little while, but it's about our numbers of contacts. This is truly in the escalation when it becomes critically important. Over the next 2 to 3 weeks, I need you to take healthy at home, and I need you to ratchet it up multiple notches. We need to make sure that we are not business as usual, and we get as far down and as close to the red line, cutting 75% of our contacts as possible. And what does that mean? It means other than going to work, other than getting supplies that you need, and other than getting outside with your kids but engaging in that social distancing, I need you, especially over the next couple weeks, to be as diligent as you possibly can. It's going to be really important to protect the people around us. But I know that we can do this. We've been preparing for it. We've been taking escalating steps every day, and I can tell you your work is already paying dividends. But now is the time to do everything we can. Now is to take that duty that we've been talking about and to truly believe it. Now is that crunch time where so much of what we do is going to better protect the people around us. So please follow the guidance more than you ever have. And for those that are going out to get supplies, and you're always going to be able to, the grocery store's always going to be able to be open. You're always going to need to be able to get the things you need in your home. But that can't be a place you go because you're bored and because you want to be around people. If people just go to the grocery store or Walmart just to be close to other people, then we will frustrate the sacrifices that people are making out there. So Kentucky, these next 2 weeks are about us doing everything we can to blunt the increase in this curve, to truly flatten the curve. And I'm telling you, if we can be really diligent, I can't tell you that after 2 or 3 weeks that we'll be able to stop. We probably won't. But I can tell you the next 2 to 3 weeks are going to make a huge difference in people's lives. So do it for the people you love and care about, but do it for everybody else too. I've said numerous times that this is the ultimate test of whether we're good people, and I know we are, and whether we're willing to be a good neighbor, and I know we are. So this is it. It is our time, and we absolutely must pass this test. I'm going to ask Dr. Stephen Stack to come up now and to talk to us a little bit. I will then give the update on new cases, and we'll move into some really positive news over the last couple days. Dr. Stack.
Thank you, Governor Beshear, and good evening, everyone. I want to start with some positive things. I want to thank everybody. So the governor shares his stories, but all of us on Team Kentucky here in the Capitol are getting stories like this from all over the state. A few shout outs. Thank you to the Lexington Clinic. Your leadership reached out to me to clarify some of our guidelines to do the right thing for patients. Thank you to Norton Healthcare. You're doing some really bold and innovative things now to try to rearrange how you provide care and be prepared if more sick people show up at your doors. Thank you to you. Thank you to ARH in Eastern Kentucky. The leadership at your hospital not only is preparing to help your communities, but offered to help others should the burden of disease not be as great in Eastern Kentucky. Thank you to you. Thanks to all the individual clinicians. I've got doctors, I've got nurses, I've got other clinicians sending me stuff. Thank you for understanding that I can't get back to all of you individually, but I get it every different direction and I use it, and thank you very much. Thanks to all the kind people who are donating things. A fellow emergency physician of mine said that he opened his door and there was a box of unopened N95 respirators in a box. Someone who he does not know dropped that off and left that for him, knowing that he would be in an ER in harm's way. Thank you. And because the governor teased me when I shouted out my college, I'm going to shout out my St. Joe East ER people. Thank you so much. They made Don't Be a Honeybee Dr. Stack t-shirts like the meme you've seen. Thank you for that. And I know they're watching this because this has become a regular occurrence in their lives and so many others. A shout out to the healthcare workers. They're in harm's way. They don't have the gear they need. We're working as tirelessly as we can to get them the gear to keep them safe. But I want you to know they're showing up every day to take care of you. So please be kind to them. And from me to you, thank you so much for your sacrifice. Now a few serious things to add on what the governor has already shared. The governor is going to be a pretty good epidemiologist before this is all done. All the slides he's showing you really convey why this is important. I try to be careful not to present data to you until I feel confident that the data is solidly supported and accurate. We are getting more publicly reported sources lining up the Kentucky experience relative to other states and nations, and the early signs are really good. What you are doing, the healthy at home approaches you're taking, appear to be having the effect we hope. So I want to thank you. We know the sacrifices have been hard, but I need to urge you, just like the governor has, we are in crunch time. and the next 2 to 3 weeks are pivotal. So I know this will be difficult, and we thank you for your efforts. But there are a few people I have to call out, or at least types of people. If you're a college kid and you went on spring break, assume you have this infection now and self-isolate and keep yourself away from your family members, because you just went to an environment, probably on a beach with a lot of other young people, that is the buckshot model, where now you could come back and scatter that disease. So if you did that, please self-isolate and stay away from others until you get past the 2-week period. For little kids, look, this is socially difficult, and isolating their human connection is so important. It's one of the reasons that the governor showed the video at the start. Play dates, though, group play dates, those should not be happening. That is another buckshot model where you're going to bring them together and one sick person can spread it to many others, and then bring it into your house. So it's the buckshot plus the honeybee model. So don't do that. No more group play dates. Get outside in the great outdoors and spread around. That's fantastic, but no group play dates in-house. For everyone else, we can't call out everybody, and this is not about forcing people to do the right thing. It's about inspiring people to do the right thing, because it's what's good for us and it's what's good for everybody else. Never before has it been more important to be a good neighbor. So please model that good behavior by complying with these requests and these orders voluntarily. And when you see other people doing it, please thank them. Please be kind. And when you see other people not modeling it, hopefully this social pressure that has become the norm is what's going to help us get compliance out of those who either don't take it seriously like they need to, or for whatever reason choose to disregard it. And please be patient with each other. We do get examples where there are misunderstandings that occur. We realize the rules as we've known them have changed dramatically in the last few weeks. Please, we still have to have people work with each other, be patient, and try to trouble solve how we've changed things so that it works both in your work environment and back in your regular lives. So again, I don't end these without ever forgetting to thank the governor, because I think this approach has hopefully helped you to get accurate and actionable information, and has helped us as Team Kentucky come together. And I do believe together we're going to show when we look back that we turned out and did better than a whole lot of other places who didn't come together in this way. So thank you very much, Governor Beshear.
Thank you. Just to add on to what Dr. Stack just told us, we do have our first case of someone that went on spring break to Florida and came back with the coronavirus. We cannot do that. If we haven't been clear enough, we're in the middle of a worldwide health pandemic. The answer is no, we can't go on spring break. It is right now something that puts everyone around you at risk if you do. We've even had to shut down a building because of this for a period of time. So I know you had plans. They ought to be shutting things down in Florida. I cannot control that. Don't go on spring break. You're going to put your health and the health of your family and the health of those around you at risk. Let's go over new cases as we have today. It's hard to think that there's some good and some real tough news in this. So as of this afternoon, we believe we have 198 confirmed cases in Kentucky. That is 35 new cases. And that means these are fewer new cases than yesterday. And we're probably one of the only states right now that has been able to give a report where we have had a day that is less than the day before. But we expect there to be new cases each and every day. We are sad to report today that we have our fifth death here in Kentucky. That is a 75-year-old male from Jefferson County. So tonight we'll be lighting my house up green, and we hope everybody out there will light theirs up green as well. It's out of compassion for this person, for their family, for everybody that is going through this coronavirus, and for renewal, knowing that this individual's spirit will live beyond his body, and that at least my faith says that he is going to a much better place. We are thinking about him and his family, and as we work through these hard times, we want them to know how much we care about them. Of the new cases, I can only confirm certain ones in counties. It looks like 1 new in Davis, 4 in Fayette, 1 in Franklin, 2 in Grayson, 3 in Jefferson, 1 in Jessamine, 4 in Kenton, 1 in Laurel, 1 in Madison, 1 in McCreary, 1 in Nelson, 1 in Oldham, 1 in Warren, 1 in Wayne, and we are working on the others. It looks like we have at least a couple more labs that have come up online, which again, that's a good thing, that we have more tests coming into Kentucky, but it does make it harder on the numbers. But again, we are seeing a lot of cases, and we will expect to see a lot more. Again, we expected it. We're ready for it. We're going to make it through it. And even with another fatality, and it was someone that had, other factors that contributed to it, we're going to breathe. We're going to be tough, and we're going to get through this. And everything we do, every recommitment, every day at 5 that we recommit to follow these rules means we protect someone else out there. Now, I've got some good news today. News that we've been hoping to report for a little while, and that's on unemployment. I'm happy to report that as of today, independent contractors, small business owners, substitute teachers, gig economy workers, child care workers from churches, cosmetologists, and anyone who has had to leave their job because of quarantine or paid leave now qualifies for unemployment in Kentucky. This means that so many of you who are out there who were worried are now able to file, and we want you to. If you have already filed because we asked you to, you don't need to do anything else. If you have not filed, and can we go to the schedule, Kenneth? If you have not filed, we want you to follow the schedule that we put out for this week for people to sign up for unemployment. When it comes up, it'll show that we've asked people to sign up by last name. If your day has already passed, go ahead and try to sign up tomorrow. If your last name is coming up later in the week, please wait until that date. But this is important. Again, there is zero stigma, zero, to being on public assistance right now. So the government, state government, and I are making decisions that have caused a lot of this. And I will tell you, I feel that every day, understanding that many of you out there aren't in a job that before we asked you to make this sacrifice, you otherwise had. I want you to sign up for unemployment. I want to make sure you have enough to get through this. Knowing the ramifications of the decisions that I've made, and it's on me, I want to make sure that you get through this in a good place. We are still getting the final parts of a federal stimulus package that came out. We hope to be able to have that information tomorrow. It looks like there will be more dollars in unemployment for individuals, and the period of time will be longer. All right, second piece of good news, and this is good news, is that we believe beginning next week, we will have at least the first test facility for drive-through testing for the coronavirus here in the Commonwealth. Now, it's going to start very limited. We're going to start hopefully on Monday with a single location that'll be for very specific individuals that are showing symptoms. It's going to be a proof of concept. And provided that that proof of concept works, we believe we will have at least a couple more open, again, to limited populations at the start next week, and we may be able to expand it further from there. This is a partnership that I hope that we will be able to announce in full tomorrow. It is exciting. I want to make sure that we are fully there before giving all of the details, but this ought to give you not only some hope, but to be a report back about the things that we've been working so hard behind the scenes on. Now, even if we get this plan up fully and expand it in the way we want, understand at the beginning resources are still going to be limited, even though they will be significantly more tests than we have seen to this date on a large scale. But with the way the coronavirus is spreading and how quickly it's spreading, we will still need to use those resources wisely. which will take all of your patience. I know everybody out there wants to get a test because you're nervous, but again, this is our test. Our test of can we, as a society, as a commonwealth, as a people, understand that the resources need to go to those most in danger and those who are the most sick. And for everybody out there that will have to wait, we appreciate your sacrifice getting through this, understanding it truly helps. Next piece of what I think is good news is that we put out our executive order that I'm going to have further clarification on in a minute, on the additional closures we've had to have, to where we have suspended any evictions in the Commonwealth until we get through this. I'm asking everybody to be healthy at home. Healthy at home. More so than any of us have done over the next coming weeks, which means we can't kick people out of their homes. Not right now. We appreciate everybody and their help doing that. Wanted to mention that beginning probably middle of this week and into next week, you're just going to see some additional law enforcement and some National Guard at our hospitals. This isn't something to be concerned about. It's just as we see a surge and as we see a push on our healthcare facilities, we just want to make sure that everything is calm the entire time as people are coming into the facilities, that everything works the way that it should. And we just believe that this is going to be an extra calming presence. Nobody's patrolling your neighborhood. It's nothing like that. It's just making sure that everybody inside those hospitals, when we have a surge, is safe, and that everybody coming in to those hospitals are safe. Remember, these are people you work with. They're the National Guard. They're people you interact with every single day. They just don't wear their uniform. And they're just going to help us get through this time to make sure that we can help everybody that needs help. Next piece before we get to the latest executive order is telehealth. We have entered various orders to allow more telehealth in Kentucky than ever before. And what that means is for those of you that don't need to immediately see a doctor but have either ongoing conditions or reasons that you need to talk to or get services, you can now do more of that than ever through telehealth. So I've asked Secretary Freelander to come up and to talk a little bit about that.
Thank you, Governor.
Thank you.
So just like the video in the beginning was to a targeted audience, this is to a targeted audience as well. This is to providers of services in Kentucky. We often talk about our best practice, and best practice is often in-home, in-person service. But we have a new best practice today, and that best practice is how not to spread this coronavirus. To that end, we have expanded telehealth services. We've expanded opportunities for people to connect virtually with people in their homes. This is important because we can do so much now through virtual means, through FaceTime, through Zoom meetings. There are all sorts of ways that we can connect with healthcare providers. In Medicaid, we've waived a lot of the requirements around what is needed to do telehealth. You can do telehealth. You can use various means to do telehealth. You can use things that formerly weren't considered to be HIPAA compliant. Again, I know I'm speaking to a very specific audience, but you can do this. We've cleared all of the obstacles out of your way. We've changed how we do reimbursement for you. We've got waivers from the federal government to do this. So feel very comfortable in being able to provide telehealth services, telehealth and virtual in-home services. We've waived requirements for in-home services for services like First Steps, Hands, and all of our waiver services, Michelle P., SCL. Again, I know I'm speaking to a specific audience. But to the extent that you can, make sure that when you connect with somebody you're trying to serve, either in a facility or in their home, that you do this virtually. And this also then goes for folks that we don't normally think of in this way. We've expanded the number of people and the types of folks who can participate in telehealth. And this, I think, is most important to people who are providing substance use services. We're allowing virtual interaction in peer-to-peer. We're allowing virtual interaction for case management and care planning in all of our programs. So please take advantage of this. I've had people reach out to me who are doing 12-step meetings through Zoom. That is the right way to go. And it is possible and it works. Please, to the extent you can, use virtual link-ups to provide these services to those that need them. This is a challenging time for those people with substance use. This is a challenging time for people with behavioral health issues. Please connect with them. We are giving you the opportunity to do that, and we are giving you the opportunity to do that in the way that is the best practice now, the way that does not spread this coronavirus. Thank you.
Next, I'm going to ask my Chief of Staff, Latasha Buckner, to come up and to talk about our newest order about life-saving businesses. As you know, we've put out a new order that's going to ask some additional businesses to make additional sacrifices. We wouldn't be doing this if it wasn't absolutely necessary, and if we didn't know. We are in that 2 to 3 week period that may be the biggest difference on the number of Kentuckians that we can protect. Latasha.
Thank you, Governor. Good afternoon. As you know, we've put out a new order, and we want to kind of give you some big points from the order to take home, and then we hope that you read the order in its entirety and kind of get a feel for what everything's in there. It's about 6 or 7 pages. First of all, we want you to be healthy at home, which means we want you to be able to go to the grocery store. You have to go to the pharmacy, the bank, go to the pet store. What we don't want you to do is stay in the bank and the grocery store just to be out of the house. We want you to go out to the parks when the weather's better and go for walks around your neighborhood. But as you need those things, please go there and just spend the minimum amount of time that you need to get what you need and then move on. You can still get your roof fixed. You can still call the plumber for either your home or your business. All of those things stay in place. Industries and manufacturers that support life-sustaining things that we all need to be healthy at home remain open. If you produce scrubs and medical equipment, then you'll be able to stay open because we need you to support our hospitals during this time. And there's a complete guide to what's included in there. We want anything related to safety, critical infrastructure, which is defined by the federal government, remains open. Those businesses, agricultural production remains open. So what's changed in the order? First of all, businesses that don't support food, agriculture, creating a safe or healthy environment, shelter, transportation. If you make roller skates, for instance, you're not going to be able to stay open during this time. Professional services, we get a lot of calls about those. For those professionals, attorneys, accountants, CPAs, architects, advertising, almost all of you can already perform what you do online or by telephone. And so we're asking you to close your business to in person and just do those things by telework. During the time that this order is in place, as the governor said, evictions will be suspended. You'll still owe the rent, but no one's going to be able to displace you because you can't be healthy at home if you're not at home. And finally, we encourage those businesses who are fortunate enough to be open during this time to make sure that you're taking care of your employees, that you have ample space for them to use hand sanitizing, hand washing, plenty of stations to do that around the facility, that you're employing 6 feet rule, CDC guidelines for social distancing as practical. If you're able to have people in your store or in your business, that you maintain 6 feet between those people. And also, we want you to give paid leave, because the best thing is if employees feel as though they're going to be supported, they're going to let you know that they're feeling sick. And if they let you know that they're feeling sick, or you send them home when they show signs, it's going to keep your workforce healthier and help you stay in business. Finally, you're going to have tons of questions about this. Kenneth, do you have this slide? I wanted to say that. That's great. kysafer.gov is the site. It's been used to report businesses that aren't compliant. We want you to also use it to ask us questions if you have them about what's actually open and what's not open, because I know so many of you want to do things the right way. We're going to have on the website a place for you to ask questions, and we'll try to get back to you in a timely manner. And then you can also call the phone line as well. And that's it. Thank you.
Thank you. Latasha has been instrumental in the steps that we have taken, and we greatly appreciate her and everybody else's service. Just going to go through a couple of resources that are out there that we didn't talk about. I'm not going to go through all the steps we've taken to date, that we will get back to it tomorrow. Every day that what we talk about is similar to the last day helps create that sense of normalcy, to know that yes, we're taking some additional steps, but we've been taking steps this whole time, and we're simply getting to where we need to get to maximize the protection we can offer to Kentuckians. So I first want to show the website, kycovid19.ky.gov. This is the definitive source in Kentucky for information you need on the coronavirus. With all the misinformation out there, this is really important. Our coronavirus hotline, the next thing I want to make sure that people know about, it is where you should call if you are nervous but well, and it is on the first part, 1-800-722-5725. We're getting about 2,600 calls per day on it. We are glad to provide that service. I want to talk about the Team Kentucky Fund, which we announced just a couple of days ago, and we already have a couple $100,000 that have come in. This is a fund that's going to be able to be watched over by state government, ensure every penny is spent the way that it should, and it's going to go to help the people that need it the most as we move through this coronavirus. So many out there making incredible sacrifices. I want to thank all of our school systems, all of our food banks, everyone that's out there at a time when the most needy could be ignored. You're stepping up, and you're stepping up to help them. And I want to thank all Kentuckians for how you've remained calm. We've talked about the fact that we have two adversaries here. One is the coronavirus, and I know our anxiety is increasing as the coronavirus spreads and increases. But the other is fear. And if we let our fear get the best of us, then more people will be harmed out of this than the coronavirus ever could. So we got to keep taking care of each other. We see the best example of that in our healthcare workers, in our firefighters. You know, we had a firefighter that tested positive yesterday. I called him personally to tell him how much we appreciate what he does. All of those folks knowingly going in to harm's way to help everybody else out there, they are special, special people. So we're going to get about 15 minutes or a little bit less of questions. But again, let me remind you, this is the time. The next 2 to 3 weeks is going to be absolutely critical to doing everything we can to protect Kentuckians. Let's do it. I know we're up for it. Yes.
Governor, New York is quickly becoming the epicenter of this crisis in the country, and Dr. Deborah Birx advised people who have recently left New York to self-quarantine out of an abundance of caution. Do you have any idea of how many Kentuckians recently have left New York? Do you have a message for any Kentuckians who are planning on traveling or even coming home from New York?
Kentuckians shouldn't be traveling right now. Not to New York, not to anywhere else. You should be healthy at home. If you have been to New York in the past 14 days, please watch yourself very, very carefully and reduce your contacts even more.
Count of how many ventilators hospitals in the state have right now, and is there any estimate of how many they will need additionally in the case of a worst case surge of patients?
I don't have the question is the number of ventilators in the state. I don't have that number today, but I do have the number I think you asked about the other day, which is ICUs, and I believe we have 1,300 ICU beds in the state. Our goal is going to be to make sure that we keep those for those that need them the most. while we've had a number of hospitalizations, that figure used to be about 30% of folks that have been diagnosed. It was about 6% that have been that have needed the ICU. So our goal is to manage that in the best way that we can, knowing what our resources are. But we are also out there right now looking at convertible ventilators that the federal government has given approval on. We are doing a full analysis across the state on that. We are also even working with FEMA and others right now on other opportunities, as we've talked about, to create areas that could work as a hospital that aren't currently a hospital. We've had some really productive discussions on that, even better than the ones we've had in previous days. We've had a lot of good discussions over the last 48 hours. Now, we're about to see things get a lot worse before they get better, but we are getting some good feedback and some better working relationships as we move. I got a question here. Do real estate brokers and agents need to cease showings and open houses until the current crisis is more manageable? We shouldn't be having open houses where multiple families go through the same home and can touch things. If our brokers and agents can do individual showings and follow the CDC protocols, right now we do not have a prohibition on that. Here's another one. Are providing vaccines for children considered essential? Dr. Stack talked to me about this before I came up here. This is one that's under medical discretion that our doctors will know, but it depends on the type of vaccine. So for our infants and for our young children, those initial sets of vaccines, absolutely, they are essential. If it is a booster of something that a child can do without for a period of time, then I would not consider it essential. I think our doctors out there know, and they can always call our Department of Public Health. We have a number of questions about why are liquor stores still open. All food and beverage is still open, all of it. We're not going to close down any type of food and beverage facility during this, and we're not going to increase people's anxiety while we're facing this type of outbreak. How does this affect call centers and manufacturers not specifically mentioned, but which might describe themselves to fit into one of the sector's names? They can communicate with us, but what I would say is look through the order. It's very specific. There are links to click on to see if you fall within those areas, and then you can work with our office. One that's from one of the reporters that we have here. Tennessee is outpacing us on tests because the private labs are now reporting negative tests. Do we know if state lab tests outnumber state lab tests in Kentucky? Have we ordered or demanded private labs to report private negatives yet? Yes, we have made that demand. Yes, we are getting more. It is still a work in progress. We know that we have 3,300 tests at least now, and that's a significant increase that we knew. But our extrapolation from what we've received is we believe conservatively that there have been at least 10,800 tests in Kentucky, and we believe that's a solid number to use for purposes of our analysis. Yes?
Have you had a chance to talk to Kentucky's congressional delegation or the White House about the $2 trillion stimulus bill, and do you know how that would benefit the average Kentuckian?
The question is, have I had an opportunity to talk to our congressional delegation or the White House about the stimulus bill? Not since it has been passed. I did have a call with Senator McConnell as it was going through to give him my thoughts. It is going to inject money into the economy, which is good. I believe that we will need more stimulus after this one. It's providing money to both states and localities. We'll have to see how that breaks down. Sometimes the bills require that localities be above a certain size, and if that's the case, we might only have one that qualify for the local funding piece in Kentucky. Certainly the state piece is incredibly helpful. The Medicaid increase that happened before is helpful, but I want folks out there to know this is an adversary that we've never faced in our lifetime, and it's going to take the type of response from the federal government like none that we've ever seen. This is a step, but I do believe that there's going to need to be more after. Here's a question. I'm hearing reports that the Kentucky Safer Hotline is busy and the mailbox is full. Are we going to increase capacity? The answer to that is yes, we have had more calls than we could have anticipated. Yes, we are increasing capacity, and we now have a way through the internet that you can submit those. Again, this is just about encouraging everybody to do the right thing and to understand that when we have an unsafe environment, we do need to know about it. The calls that we make from our labor cabinet are typically constructive with the various groups, and I say business a lot. These can be organizations too. These can be a lot of different types of entities. And let me say, because I've said business a lot, that we have gotten a lot of help from Kentucky's Chamber of Commerce on a number of different ways, from retooling facilities, from connecting facilities, and I do appreciate they have been really helpful as we have moved through this. I don't want to give the wrong impression, and they continue to help.
I have a couple questions regarding the executive order on non-life essential businesses. The first one, just to clarify, vet services, pet care, are those allowed to stay open during this time?
Veterinary services, yes. Pet grooming services, no.
And kind of a broader question about that order, do you anticipate having to take further steps if this pandemic gets worse in Kentucky?
So the question is a real good one. It's, do we foresee taking additional steps from the latest order that we did? With this latest order, we have been as aggressive as just about any other state. While we'll reserve the right to take extra steps, we have gone a significant way. What we really need to do now is all of us need to do our part, reduce our contacts, make sure if we're still going to work that we are just going to work and coming home, doing things with our family. When we get outside, doing it on our own. When we need to go to the grocery store, not using it as a social hour. Now is the time that we follow the guidance as well as all of us possibly can, and we do it for the coming weeks. That is going to be the difference in protecting Kentuckians.
Justice Cabinet or Department of Corrections given you any list of state prisoners that could be released early from state prisons or county jails, and how soon might you act on something like that?
So the question is, has the Justice Cabinet given me any plans or proposals for releasing any folks possibly early from jails or prisons? I did get a proposal today that we are working through and that we hope we can move expeditiously on. So got a call saying that SNAP can't be used with grocery pickup and delivery. Could that rule be relaxed? Pickup, yes, you can use SNAP. Right now, internet, you cannot, but we are requesting a waiver from the federal government right now. So with like all of this, we're working on it. Now, in all of these systems, they were never set up to face something like we're facing now. So I hope you all see that we're working every day to address each and every concern that comes up. And we are always erring on the side of providing for you, our people. Community ministries, benevolence, food pantries, can they remain open? Can they serve hot meals? Any type of group that is providing food out there, providing that you are following the CDC guidelines, yes, we want you to be open. There's a part of the executive order that goes to that. Hot meals need to be delivered, though, in as much as possible. Even if you're dealing with populations that you would typically bring in to a facility, do everything you can to spread out, to provide those meals individually, and to make sure that while we're still taking care of people, that we're thinking of all the different ways that we can do it in the current reality that we are facing to lessen the concern that we could be spreading it while we are trying to do the right thing. Tamara Sandberg with Feed Kentucky said today, a request has come to the governor's office for National Guard members to help out at food banks. Is this being considered? We have other state employees that are going to step up and help out at food banks. It's going to provide significant additional personnel that is there. The National Guard is available when we need them, and I'm not going to be afraid to call them to help. Again, National Guard is never going to be patrolling your neighborhood. That is not going to happen. But what they may do is be providing help in as many different ways as possible. That'd be that type of help with a smile or a meal, logistics across the state. These are our friends and our neighbors They don't normally wear a uniform, but even when they do, it's going to be to help you.
Can you go over that unemployment list again, the additional service, different types of people that's going to help? So we can apply for benefits or whatnot.
The question is, and can we pull back up the new unemployment qualified folks slide? So it's really good news today. It is really good news because this system wasn't fair for what we were facing. And what it means now is that those that are self-employed, like small business owners, independent contractors, freelance workers, substitute teachers, child care workers employed by our houses of worship, churches, synagogues, mosques that previously could not get unemployment now can. This is a big step to help our people. We know there's going to be a lot more filing. If you get a busy signal or if it takes a little longer, have patience with us. This is us doing everything we can to cover every single person we can and to take what was an unfair system because of the coronavirus and turn it into something that can help everyone. Comment that I might want to clarify, the counties listed yesterday that need help with food delivery to seniors. I've had a couple of those counties say that they were surprised. Listen, we're moving fast. If you've got it handled, that's good. But we're moving fast and want to make sure that in any area where there is extra volunteers that are needed, that we get them. And if I mention an area that might not need them and you get extra calls, just do everything you can to put that good work to work. That's not calling anybody out when we do that. It's just trying to make sure that we care about all of our people everywhere. There's no ego in any of this. In any of this, anywhere. There's no Democrat or Republican. There's only us as Americans versus this coronavirus hotline. Let's take two more here, and then I'll read one more here.
The General Assembly is meeting tomorrow. They have a full slate of committee meetings. They're supposed to pass bills. How do you feel about that? Do you have any particular message for them tomorrow?
Question is how I feel about the General Assembly with a whole slate of bills that they're meeting about tomorrow. In the midst of a worldwide pandemic and in a state of emergency in Kentucky, they really need to simply pass a budget, anything related to the coronavirus, and go home. It's the safest thing for them, but it's also the right example for people out there. And passing different bills that'll get people worked up right now on any side. Again, there shouldn't be sides. We're at a place right now where we need people to be calm because there's something bigger that we're facing that we have ever seen. And we ought to be united. And we shouldn't be doing anything at all that would keep people from being united.
We've heard from some employees at a healthcare facility in Lexington who said dozens of nurse practitioners and PAs were furloughed recently, citing a significant decline in elective procedures there. Do you know, first, what's your reaction to that? And also, do you know if these nurse practitioners have the flexibility of working at another facility?
The question is about healthcare workers that may have been furloughed because of our order to cease elective procedures, and both to comment on that and what their flexibility is going to be able to be. Listen, the surge is coming. We're seeing cases increase every day. New York had 5,000 additional cases today, just today. We have to be ready for it. All these people are going to be at work because we're going to need you. We're going to need each and every one of you. And I'm sorry we had to take the step early to make sure we had that capacity, but almost all of those procedures, or so many of them, use the PPE that we are going to desperately need as this increases. The steps we have made, the steps we have taken, while they have required sacrifice, are to make sure and to do everything we can to make sure that there are going to be enough beds, enough ventilators, enough PPE, enough people that are there to help. And when we're making plans to create, to turn hotels into hospitals, to do pop-up clinics if we have to, it means that it's serious. And it means that these steps are necessary, and we will make sure that there is the flexibility, especially as we have the surge to where people can get the help that they need. I'll have to see. I'll have to get you an answer on whether they can work at other hospitals right now. One last question. Some states have begun to report the numbers of hospitalizations. Does Kentucky Department of Public Health track this information? is it available? So we have some of this. Right now, it depends on the information we get back from a lab and from a local health department. But right now, a little over a third of those that have been tested positive for the coronavirus require hospitalization. All right, we're at a little over an hour. Folks, thank you for sticking with us tonight. Thank you for sticking with the video that we started with. But you know, our preschool kids also need a way to hear and to understand about this. And I know that you're with us. And we've talked about this being our calling and this being our time. And our time is right now. The next couple weeks are going to be some of the most critical that we face. And our decisions to do the right thing, to not go on spring break and bring the coronavirus back, to make sure that we are following all these recommendations and to limit our contacts even further, to see somebody we might know in the grocery store and only wave from 6 feet away, because we know right now is the time where we've got to do everything we can not to spread this coronavirus. If we all do this, we will not only get through this, but we will protect so many people around us. I'm proud. I'm proud right now to be the governor of the Commonwealth of Kentucky, because you all are bought in and what you are doing is making a difference. And given that, let's commit even more. Let's commit even more to do even more, and if it takes it to sacrifice a little bit more. Let's try to be a model for the country, but more, let's be a model for humanity that says that we are willing to do more social distancing. We are willing to cut more contacts, knowing that through technology we can still speak to each other, to provide the maximum protection out there for our people. I don't normally say this, but it is, for many people, a matter of life and death as we go through this. That's not to stir people up. I know you can take it. We've been talking about this for a while. I know what we do is we hear that, we understand it, we breathe, and we recommit to doing the right thing and to helping each other. Team Kentucky, this has been special, seeing you come together. Together KY, the acts that you are doing to help each other. We are showing the absolute best of humanity, but we got to do even more. All right? So these next 2 to 3 weeks, and we'll report as we go, these are going to be the critical time. We can do it. We've always done it when we are challenged. And I know this generation, our generation, everybody who's watching right now, all of us, we can take on this coronavirus. We can protect those around us. We can win this battle. Thank you, Virginia. Thank you, Kenneth. Thank you all very much.